Yeah, so first we have to focus on affordability. Republicans are pointing out that if somebody gets a policy with a $6,000 deductible, that's effectively no policy. It brings profit to the insurance company, but not protection to the patient. So what can we do? And by the way, as a physician, I can tell you patients come distraught. They cannot afford whatever you're ordering because their deductible is so high. That's the case of these policies. Republicans have pushed that we would put money in the patient's pocket so that she has something to pay the out-of-pocket. Democrats are saying let's do something about premiums. I think, Donna, there is a deal that could be made. Why don't we do both? Let's go ahead and not give the profit to the insurance company, but the protection to the patient by giving them access to an account, a wallet, a purse, a pocketbook, if you will, that would have up to, pick your family, $1,000 to $5,000 to pay those initial expenses. But also do something on the premiums with maybe a temporary extension of the enhanced premium tax credits to address it for some, those who really have high expenses. I think there's a deal that could be done. It has to have reforms to cut out the fraud. There's an estimated billions of dollars in fraud the way the current system is currently constructed. But if you address the fraud, and particularly you address the fact that the premiums being pushed, the policies being pushed have $6,000 deductibles. Again, it's more about profit for the insurance company than protection for the patient. If we do that, I think there could be interest in a short-term extension. I think that could be the deal. Yes. Well, I can't tell you it's in the offing. It's something that's being worked on because we've got to do something about affordability. Again, health care is so important to a family. And we're talking about the Obamacare exchanges, which is only 6% of the total insurance market. But it's an incredibly important 6% if you're in that 6%. And maybe we can do other things which help affordability across other areas like employer-sponsored insurance. The first thing, though, is to diagnose the problem, speaking as a doctor. And to diagnose the problem, you've got to address the issue of the out-of-pocket, which is so high for so many that they just cannot get the care they need. And then after that, let's go to the premiums. I think if we can meet halfway on that, we can find common ground, we can do both. Yes, we've got 4 days, but some of this policy could be implemented over the course of the first quarter of 2026. For example, if you have money in your account, your health savings account, you save your receipts and you submit them, and then you get reimbursed. My wife does that with our account like that. So let's put money in their pocket to pay the out-of-pocket. That really addresses affordability, and then help those who also have the higher premiums.